The back is an intricate structure of bones, muscles, and other tissues that forms the posterior part of the body's trunk, from the neck to the hip bones and pelvis. The bones that form the core of the back structure are called the spine or spinal column. This stack of more than 30 bones, vertebrae, supports the upper body's weight and houses the spinal cord, the nervous system structure that carries signals which control the body's movements and convey its sensations. Each of the bones that make up the spinal column has a hole in the center, and when these bones are stacked, it creates a channel that surrounds and protects the spinal cord. The bones or vertebrae that make up the spinal column are not stacked directly on top of each other. There are spaces between them that are maintained by round spongy pads of cartilage called intervertebral discs. Each intervertebral disc is made up of two components, the annulus fibrosus and the nucleus pulposus. The annulus fibrosus is the tough outer portion of the disc. The nucleus pulposus is the inner gel material surrounded by the annulus fibrosus. These discs and the space between the bones that they fill give the lower back flexibility. The discs act much like shock absorbers throughout the spinal column to cushion the bones as the body moves. Bands of tissues called ligaments and tendons hold the vertebrae in place and attach the muscles of the back to the spinal column. Small nerves called roots enter and emerge from the spinal cord through spaces between the vertebrae. The spine has 4 regions. Starting from the top, there are 7 cervical or neck vertebrae, labeled C1 through C7, 12 thoracic or upper back vertebrae, labeled T1 through T12, 5 lumbar vertebrae, designated L1 through L5 in the lower back, and finally, the sacrum and coccyx, a group of bones fused together at the base of the spine. Intervertebral discs are located between each vertebra from C2 through S1. As we age, a number of changes can occur in the spine, which may contribute to or cause lower back pain. For example, the annulus surrounding each disc begins to develop tears and cracks, which can cause pain and inflammation. The discs also begin to lose the water that keeps them spongy and enables them to absorb shocks and help protect the spine. As the discs lose water, they become compressed or flattened, which reduces the space between the vertebrae. In turn, the facet joints that connect the vertebrae and allow for easy movement are compressed. Pressure builds on the cartilage that covers and protects the bones from rubbing directly against each other, which can damage the joints. These changes may result in looser, less stable movement, which further increases the process of degeneration. As part of this process, the tough outer ring of the discs may develop larger tears so that the nucleus bulges out, what is commonly called a slipped disc, pressing on the spinal nerves and causing inflammation. The vertebrae may also lose mineral content so that the bones become thinner and the spinal column becomes compressed or packed together, causing pain. Bone spurs caused by aging and overall use of the spine may also form on the vertebrae and press on the nerves of the spine.